Good morning, everyone. I would like to introduce the first speaker of the day, Dr. Divya Giridhar. She's an associate consultant in Giridhar Eye Hospital. She's finished a cornea and refractive fellowship from Shankar Netralaya, Chennai. Over to you, Dr. Divya.
Good morning. I'll be talking about the need for a dry eye clinic and role of an optometrist. As we all know, dry eye is considered in today's day as a silent modern age epidemic with a global prevalence ranging from 5 to 50% depending on the geographical location. So there is an increasing incidence of dry eye in today's world due to various factors like the urban lifestyle, increased screen time, aging population, etc. So it affects people of various age groups. And also, not only the patient suffers from inconvenience and irritation, but they also have a serious impact on their quality of life, and it can also lead to a loss in productivity. It is also associated with long-term economic costs since these patients are on long-term treatment, and some of them are even on systemic medication. There is also a possibility to progress to a chronic ocular surface damage and hence the need for timely diagnosis and treatment. So just a brief recap on the definition of dry eye. It is considered as a multifactorial disease where there are various etiological factors. So a patient presenting to us can either be a symptomatic patient with or without ocular signs or a asymptomatic patient with or without ocular signs. So it is very important to address both the symptoms and the ocular signs of the patient with detailed evaluation and finally diagnosing them as either an aqueous deficient dry eye, an evaporative dry eye or a mixed dry eye. So to evaluate them better or to understand them better is why we need a dedicated dry eye clinic. So a dry eye clinic provides an environment where we can thoroughly evaluate these patients. It provides focused patient care. We can have a more comprehensive approach in evaluating these patients, integration of diagnostic tools under one roof, and finally providing them with customized treatment. So when we have decided to dedicate a space for a dry eye clinic, what all can we include in this clinic? So everything from history to examination and finally to treatment is something that we can include in this clinic. So a basic dry eye clinic can include all the simple tests that we conduct routinely in our OPD like Schirmer's test, staining of the ocular surface, etc. Whereas an advanced clinic will also include, in addition to these simple tests, you can also include the various diagnostic modalities of the image of the tear film and the meibomian glands. So now we know what we can include in a dry eye clinic. How do we go about evaluating this patient? So first will be history and the administration of the questionnaire. So there are various questionnaires that are available for dry eye. The Ocular Surface Disease Index questionnaire is one of the most commonly used questionnaires. So a questionnaire basically helps us to understand or quantify the problem. We understand how much the symptoms are affecting his or her quality of life. So following the questionnaire and the history taking is when we start evaluating the patient. The test for dry eye can broadly be divided into either the non-invasive test or the invasive test. The non-invasive tests basically include the imaging of the ocular surface, that is the tear film and the meibomian glands. So it is always important to understand that before we do any kind of non-invasive test, certain points to be kept in mind is don't instill paracaine, don't stain the ocular surface, don't instill dilating drops, don't do a Schirmer's test prior to this, because all this can disturb the tear film. So following this, firstly we do the non-invasive test. This is basically the imaging of the tear film. This is the ocular surface analyzer, followed by the imaging of the meibomian glands and evaluation of the lipid layer thickness. Following this, the next step would be doing the invasive test like the Schirmer's test and the slit lamp examination. So the slit lamp examination will include everything from examination of the lids to the ocular surface, staining, the corneal staining, the conjunctival staining, examination of the lacrimal gland, etc. So that's where our evaluation ends and we come to a diagnosis of the cause of dry eye. So a dry eye clinic can also include other customized treatment options like this is the LipiFlow. So this kind of customized treatment option can also be included in your dry eye clinic. So at the end of examination, it is always important to document all these findings. So a performer like this can be created where we can, roughly write every finding that we have found to a particular patient. So by doing this, this includes even the history of any underlying systemic disorders, any regular medications, which can all be risk factors to dry eye. So with this kind of approach, very systematic approach in evaluating the patient, we can prevent either, over or underestimating any clinical signs of dry eye, and also monitoring these patients in a more efficient manner. So the entire evaluation is quite extensive and it's quite time consuming in our busy OPD. So that's where there is a role of an optometrist. So an optometrist can form an integral part in your dry eye clinic. One or two optometrists can be trained to take history, to administer questionnaires and also perform various diagnostic tests. So they are conducted in a more consistent manner for all the patients who are referred to such a clinic. They also help in identifying patients who may require detailed evaluation, as the patients usually go to the optometrist first and then they can be referred to a dry eye clinic. Again, as I said, there's a more structured approach in evaluating this patient, and they can also help documenting the findings. So to conclude, a specialized approach enables precise diagnosis of the type of dry eye so that we can provide a more customized treatment for the patient. The term dry eye is often misused, sometimes even misdiagnosed, overtreated. So such an approach helps us to reach a better diagnosis and treat the patient. Also, a lot of patients who are on empirical treatment for dry eye and who don't seem to be getting better, it is very important to identify them for a detailed evaluation and maybe even a systemic evaluation. Thank you.